So it is audible and visible.
Yes, sir.
All right. So today we are going to cover various other topics, including disability prevention and promoting inclusive health solutions. My name is Dr. Navneet Deshpande, and this topic is taken from week 5 of global healthcare and non-profit organizations. Now, for today's agenda, we have the first topic as disability prevention and rehabilitation. The second topic is touching upon tropical diseases. We'll see which are the other things whereby the non-profit organizations can help. The third one is essential medicine availability and capacity building in various parts. And then we touch upon HIV and AIDS and worm disease eradication and how to have a global fund to fight against HIV and AIDS. Then finally, we touch upon the topic of infant mortality and measles initiatives. So let's try to understand the disability prevention. So disability prevention is a cornerstone of global health, especially in low and middle income countries where many disabilities stem from preventable causes. It combines medical interventions like vaccinations at the early childhood and early screening with social strategies such as education and creating awareness along with safe environments and public awareness. By addressing the root causes before they can become long-term impairments. So some of that it can be mostly prevented. So disability prevention reduces the suffering and it also lowers the healthcare costs over the entire society. So it promotes healthier, more productive lives for individuals and communities. It's not just medical issue, but it's a public health issue along with social issue, and it is ethical responsibility of the society that everybody is benefiting from the disability prevention. So the first part, as we all know, that right in the childhood, people give various types of vaccines. So it is immunology which is at work and which prevents disease from spreading. And this kind of mass immunization campaigns have been instrumental in eradicating the diseases like polio, which once used to be causing lifelong paralysis in the individuals. So these programs prevent disability at the source because most of the things have to be at the basic care center, at the clinics as well as hospitals, by protecting the children from infectious diseases before they develop severe complications. Now, what is very important is the earlier it is detected, the more better it is for the children. So things which go untested, mostly in Indian conditions, when the child is born, they will not check whether it can hear properly or whether it can talk properly. So early detection of hearing and vision problems in children can prevent long-term developmental delays and improve the educational outcomes. So prevention is always better because the earlier it is identified, the more care one can take. So regular vision and hearing checks in the schools and even in the hospitals and clinics will help identify what kind of impairment the children are born with before they affect their learning and social development. So it may translate into developmental issues in the long run. So in the earlier it is identified, the people can take a lot of care about it. And this requires accessible communication in healthcare sector. For instance, and the girl shown over the picture is learning the sign language. Indian sign language is a different, international sign languages are different, and it can also use hearing aids and accessible mobile applications these days are available to ensure that people with sensory disabilities like hearing and even some kind of vision can fully participate in medical consultations through the communication along with caretakers. So they receive the timely care which is extremely important in the growing years. So this builds a trust and improves the health outcomes. Then what we call as prevention could be primary prevention in action. So the community health workers are training the parents on safe childbirth practices. So the kind of precaution which one has to take care of, what has to be consumed and how much of rest has to be taken by the woman, how many holidays she can apply before the childbirth. That kind of awareness creation is also a part of prevention at the primary level, and even providing creches and cradles in which safe birth can prevent injuries is most important, because most of the people are traveling more these days. So providing safe transportation and childcare facilities is what is required in action. Then babysitting places can also be arranged. Apart from that, a lot of information about nutrition, of how much additional food requirements the children and the mother may want. So that will help the nutrition to have resilience in their life cycle. So the first question in the MCQ round, let's try to gather if everybody has understood. Uh, which level of prevention focuses on stopping disability before it occurs? Can anybody guess? Is it primary prevention, secondary prevention, tertiary prevention, and rehabilitation? I'll repeat the question. Which level of prevention focuses on stopping the disability before it occurs? Okay, good. Many people are telling C, Shalini, and I C, Jevin, C. All right. Okay, so now let's look at the answer. It's a primary prevention. Congratulations for those who have correctly answered. Now let's try to see the three levels of disability prevention. Now, the primary prevention, as we were talking about, is stopping the disability before it starts, because primary prevention focuses on eliminating the risk factors before any disability occurs. So, this includes widespread vaccination programs in the first place, then safe maternal practices and care, then proper nutrition during the pregnancy and childhood, the do's and don'ts during pregnancy, and safe road and work environmental places where there's a lot of people going from one place to another place. For example, ensuring that all children receive routine immunizations and prevent diseases like measles and polio. Then triple T vaccines and various other vaccines, DPT vaccines. Similarly, promoting balanced diets in places where it's possible, which will help for safe childbirth, reduce the risk of developmental disabilities over a long period of time. Because the malnutritious food, which in India is very much prevalent in many states and many rural areas, so a lot of attention has to be given to nutrition as well during and after the childbirth. So this level of understanding is most cost effective because it prevents problems before they arise. The second topic, which we have just now talked about, is early detections, which will save lives in the long run. So, secondary prevention involves early screening of for conditions like whether the newborn baby has a diabetes or a hypertension, or the mother also has any kind of vision problems. So, detecting these kind of issues early on, that will help for timely treatment, and it will help further complications that can be dealt, uh, such as amputation or blindness, or people do not know the sugar levels or the BP levels. Extra care can be taken if they are detected early. Then, secondary prevention in practice also involves screening of chronic conditions, like whether they have any learning disabilities or behavioral issues, or kind of uh, several attacks in between, or paralysis, or any kind of things which is caused due to extreme weather conditions or certain actions which are beyond the control, or whether it is due to the conditions in which childbirth has taken place, or it has taken place at a not matured level in which they have to use incubators. Then The screening also has to be done in all these things. So high blood sugar or high blood pressure detected early can be managed with lifestyle changes can be suggested, diet can be suggested along with medication, preventing long-term disability. So the coming to now the tertiary prevention, healing and empowering. So anybody and everybody would like the person to be taken care, which requires rehabilitation in the surroundings. So therapies are also like physiotherapy for the children, occupational therapies, and of course these days people have are witnessing speech therapy and psychological counseling over a period of time, in which assistive devices are also used like wheelchairs, hearing aids, communication boards, which will help the people to regain independence, and they can at least start to rely on themselves over a period of time. People can participate in many other activities in the daily life. So this level ensures that disability does not define a person's future. They should not be, restricted to get chances of either in academics or in jobs further, so that a grown-up individual will contribution for the betterment of the society. So tertiary prevention, healing and empowering, in which all of the therapies are given: physiotherapy, occupational therapy, speech therapy, and counseling at the psychological level. So inclusive health solutions in communities, like for instance, the community can involve the NPO non-profit organization can involve in rehabilitation. You can see the volunteer who is affected with disabilities, and the person is being taught how to cook. So because normally it takes a lot of time in order to develop the cooking skills. So person has to be nurtured and be taken care with assistive precautionary measures. And daily the routine for daily living, like exercises, walking, and going at various places for relaxation, that also helps a lot for socializing. And third is building strong family connections, and having lessons from small businesses or people who are running in small businesses, empowering families who are having rural small, very small micro level businesses. They can be assisted in order to know how to support these kind of health challenging conditions. And now coming to pole 2, early screening for vision and hearing problems is an example of A, primary prevention, B, secondary prevention, C, tertiary prevention, and D, curative medicine. Okay, people are telling C. If question is not got, I'll just repeat. Early screening for vision and hearing problems in the newborns is an example of primary prevention, secondary prevention, C, tertiary prevention, and D, curative medicine. Okay, the correct answer in this case has been secondary prevention, and the support which we are giving is the tertiary prevention. So early screening is what is required, and then we give the support, tertiary prevention care. Then the next is physiotherapy and assistive devices which they use along with rehabilitation services belong to which level of prevention? A, primary prevention; B, secondary prevention; C, tertiary prevention; and fourth is preventive screening. Okay. So the correct answer is C, tertiary prevention. Thank you for all those who have appeared and answered for this question. Now, a lot of that change requires driving together and understanding the causes and thereof, understanding the global partnerships. So, as we all know, the non governmental organizations and the NPOs across the world are more or less in synchronization with the World Health Organization, the UNICEF, the United Nations Children Economic Fund, and the World Bank provide funding, technical guidance, and policy support to strengthen the disability prevention systems. WHO develops global standards and promotes universal health coverage, and UNICEF focuses on maternal and child health, along with the early childhood developmental issues. So NGOs operate directly in an underserved areas, offering screening, training, and assistive devices. These partnerships ensure that even the most remote communities have access to life saving interventions and inclusive services. So, together, they can prevent the disabilities which are cropping up here and there, and they can build dignity for the human beings so that inclusive health is guaranteed. Now, coming to the next topic is research on tropical diseases, a global imperative. So, tackling those so far who have been neglected